Hey guys, this is a quick setup video for SpaceOAR and fiducial marker cases using the stepper stabilizer to hold the probe instead of the Artemis. As you can see, the equipment we have for these cases is the stepper, which is here on the right, the ultrasound system, and if possible, it's great to have a rolling monitor. Most of the time, the facilities have this available. We want to make sure that the monitor has a DVI import or plug. That way we can feed the DVI cable from the ultrasound to the monitor. So basically you're just connecting it to the DVI port from the ultrasound and then running it to the DVI input for the monitor. And you might have to have the staff help you to change the input settings on the menu. Usually there's a button on the screen that you can change the input to DVI or digital, and that will make sure that the image shows up on the monitor. It's a lot easier then, because then, when the patient's legs are in the stirrup, it's a little bit difficult for the urologist to see the ultrasound screen around the leg. So that allows you to move the monitor alongside the patient, and the urologist can actually see the image right in front of them. So it makes it a lot easier for them to see everything. For the ultrasound too, you want to make sure that the adapter is plugged in for the dual port. So the biplane probe, the two plugs will plug into those two ports. The adapter plugs into the Noblus. When you do that, a menu appears on the screen. If you've watched the other videos, you just hit enter to say okay on that menu. You can review those videos for a little more detail on setting up the ultrasound probe and the Noblus for these cases. There's a little bit difference on turning off the auto freeze than when you're using the Enfire probe. And the ultrasound probe is prepped a little bit differently than typically for fusion biopsy. So please review those videos if you need to get a little more detail on that. For the stepper setup, it's really just two pieces. The main piece is the big base with the arm, and then the cradle is separate. So it might be attached for you already. If not, it might be in a separate case. As you can see, it basically just slides on, and you want to make sure that it fits flush against the metal here. If it's a gap like that, it means that the nut on the bottom is not loose enough when you slide it on. So you want to make sure that's really loose. So you might have to take it off, loosen it up a little bit so that nothing is sticking up through there. If anything is sticking up, it'll make it so it doesn't hook up flush. So make sure that's loose enough that that's flush, and then you can tighten it down tight so it doesn't move. You want to make sure the big silver bolt on the cradle is facing the back side or facing toward you. If it's the other way around, then you have this backwards, because it is possible to put it on both ways. So you want to make sure that that silver bolt is on the back, because then it's a lot easier for the urologist or you to tighten this down when the probe is in the cradle. Basically, the probe will fit into the cradle here, so that the tab that's on the biplane probe is flush against this front side. You'll see there's a little tab sticking out that needs to be flush against the side. If it's too far up or back, it won't lock in properly. So once it's flush, you just cover it with this latch, tighten this down. Make sure you check it, because as you can see, I tightened it all the way down, but it's not actually latched. That's because it wasn't all the way back before I latched it. So make sure you loosen it all the way till that's clear, and that'll fit in there flush, and then you can tighten it down to lock it in, and then it shouldn't move. You also want to make sure that this is in the front. That's another indication on if you have things oriented properly. The big bolt should be facing the back, the small bolt in the front. You can see the arm is jointed, so you have to be careful when you loosen this bolt here. It'll make basically the arm and the cradle just drop, and you could risk damaging the probe. It could hit the floor, etc. So make sure that whenever you loosen this, you're holding the cradle so it doesn't drop. And sometimes you have to remind the urologist to do that. You want to make sure the arm is bending backwards, because that gives you a little more range of motion to go in and out. Also, there's a little notch here on the arm where the cradle is jointed. You want to make sure that's facing back. You don't want it to be facing forward or down or up. It has to be facing kind of back toward you, and that allows you to angle the cradle which is useful when the urologist is trying to center the prostate on the probe. And you can watch those other videos, which go into more of the centering setup that we do for axial and sagittal. It's similar kind of things between if you're using the stepper or the Artemis. The procedure itself is the same. So please review those other videos so you can get a good idea of the steps of the procedure. But when you're using the stepper, you want to make sure that the base is almost like an L shape. So you can picture the letter L from your vantage point when you're standing at the foot of the bed. That way you can roll the stepper in as close as you can to the bed. Obviously, you not have the monitor there, but you want to get it as close as you can because then the urologist isn't tripping over the base when they're trying to do the work. So typically the workflow is, the patient will be put on the bed. The staff will put the legs in the stirrup, anesthesia kicks in. They remove the foot end of the bed. The staff or the physician will prep the patient. It is a sterile procedure, so they'll use betadine typically to prep the patient, perineum. Before they do any draping, you want to bring the stepper into place. So you got to be careful. You don't want to touch the area that they just prepped, but you can slowly roll the stepper into place alongside the bed and then lock it down. So there's 3 locks on the base, and you have to be careful because it drops, by a couple inches when you lock it. So you can watch here as I lock it, it'll drop. So we don't want to insert the probe before we lock it because the probe could drop in the rectum and injure the patient. So after you've locked all 3 locks, the base is stabilized. You can then dock the probe into the cradle, lock it in, and have the urologist, by holding the cradle and unlocking this bolt, they're able to actually insert the probe into the rectum just by moving the whole arm with the cradle into the rectum. As they're doing that, you should be on sagittal view on the ultrasound screen, and that way they can basically center the gland in sagittal on the screen. If you can picture the sagittal view of the gland, they want to see the apex over here, the base over here. You might see seminal vesicles down here, the bladder will be over here. Again, you can watch the other videos which go into more of the centering of the ultrasound probe. So they're going to center it so you can see the whole gland in sagittal, and then we can switch to axial view. So by default, the button to switch is this record 5 button at the top here. You should always use that button. There's another way to switch on the screen, but it's a little bit trickier, and it's next to other buttons that might mess things up in terms of inverting the image, which we don't want to do. So just get in the habit of using the record 5 button to switch between axial or sagittal view. And depending on the switching, they're going to have to step in and step out. So the stepping is the knob here. So by turning this knob here, which is on both sides, they can go in and out. So basically they have to go in and out whenever they step to put the crystal under the prostate. And the other videos go into more detail about that. When you're using the stepper though, you want to make sure you start at the 50. So it's hard to see here, but this white line under the cradle needs to be at the 50 when you start, meaning when you insert the probe, because that's in the middle of the stepper. So they have equal movement in and out. So once they're at the 50 and they insert the probe, if they have to change, the depth of the probe in or out, they want to use this knob to do that. They don't want to use the stepper because then they won't be able to access the whole gland during the procedure. So if, for example, they needed to have more kind of motion to get to the apex or the base, you can tell that on axial, it's better to have them, step all the way out till they get to the apex. If they feel like they're maxed out on the stepper and they have a little more to go, have them unlock here and just pull the probe back a little bit and then lock it again. And make sure that when they lock it, they really crank it tight, because this thing, it will move if it's not locked down tight. And then after they do that, just have them check and make sure they can get all the way through the prostate, all the way to the SV near the base. And then come back, and they'll basically start, with the stepper back because they want to be able to track the needle coming in, from the perineum. So as they insert the needle, they'll see the needle coming in from this side of the screen, and they're going to have to rotate the probe to keep the needle tip in view. So that's rocking the probe left and right. The other thing they could do is keep the cradle level and just move the needle left and right to get the tip over the crystal. And that's how they visualize the needle tip. Again, the other videos go into all the steps of the procedure, so please review those videos, and you should be good to go. Good luck.